So, what did we discover? We'll start with the first question we asked, which was who was most frequently involved in the discussion. In asking this question, we were really trying to get the lay of the land to see, if you will, what actors were on the stage in these conversations around delays of treatment. We were curious who was on the phone in these conversations and who was being discussed in these conversations as well. Here's what we saw that manufacturers of medications, patients, and providers were most frequently involved in these conversations about a delay in treatment or therapy, followed at a distant second by pharmacies and insurance companies, followed by at a distant third by shipping entities and scheduling entities. So we know manufacturers, patients, and providers are all involved in these conversations in roughly equal measure. Around 70% or more of the time, all three of these entities were involved. Well, naturally, the next question we asked then was who was most often seen to be responsible for the delays in the treatment. Now, you may already start to be guessing in your mind which entity you think might most often be responsible. Here's what the data showed us. In 40% of these conversations, providers were seen to be the entity responsible for the delay, followed by the manufacturers at 24%, and then the patients and insurance providers at roughly 18 or 19% of the time. Now, when we see that providers were responsible or seen to be responsible in 40% of the cases, we know that these numbers are not about placing blame. And in fact, when we think about the context for these situations, it makes sense to some extent that the provider might be the source of the delay because the provider really sits at the hub between the patient and their ability to access the manufacturer providing the treatment, the pharmacy dispensing the treatment, the insurance company paying for the treatment. Really, the provider sits at the nexus of this relationship to ensure the patient is able to get onto therapy. But the numbers made us curious and made us want to peel back the onion to better understand what is at the root of the provider's delays in these cases. For that, we turned to our qualitative data.